Vascular malformations are congenital anomalies of the blood vessels that result from errors during vascular development in utero. These anomalies are present at birth, although they may not be noticeable until later in life. Vascular malformations are non-neoplastic, meaning they are not tumors, and they grow proportionally with the individual. They can affect arteries, veins, capillaries, lymphatic vessels, or a combination of these, depending on the type. Classification of vascular malformations. Vascular malformations are classified based on the type of vessel involved and the flow characteristics. 1. Low flow malformations. These involve veins, capillaries, and/or lymphatic vessels. Capillary malformations, CM, commonly known as port wine stains. Flat, reddish pink to purple discoloration of the skin, usually located on the face, neck, or limbs, may be associated with syndromes such as Sturge-Weber syndrome. Venous malformations, VM, composed of abnormally formed veins. Typically soft, compressible, and bluish in color, can enlarge over time and may cause pain or functional impairment. Lymphatic malformations, LM, composed of lymphatic channels or cystic spaces filled with lymph fluid, often appear as soft, spongy masses that can be localized or diffuse, associated with recurrent infections and swelling. 2. High flow malformations. These involve arteries or a combination of arteries and veins. Arteriovenous malformations, AVM, abnormal connections between arteries and veins, bypassing the capillary system, can cause significant blood flow alterations, leading to pulsatile masses, pain, and tissue damage. Commonly occur in the brain, cerebral AVM, but can affect any part of the body. Arteriovenous fistulas, AVF, a direct connection between an artery and a vein without an intervening capillary bed, often result in high flow states and may lead to complications like heart failure if untreated. Causes and pathogenesis. Vascular malformations result from genetic or epigenetic mutations that disrupt normal vascular development during embryogenesis. Some are associated with inherited syndromes such as hereditary hemorrhagic telangiectasia, HHT, Klippel-Trenaunay syndrome, Parkes-Weber syndrome. Clinical presentation. The symptoms depend on the type, size, and location of the malformation. Cosmetic deformities, pain and swelling in the affected area, bleeding or ulceration. Neurological symptoms, e.g. seizures, headaches, if in the brain. Functional impairment, e.g. difficulty swallowing if located near the airway. Diagnosis, clinical examination, identification based on appearance and palpation. Imaging studies, ultrasound with Doppler, assesses blood flow characteristics. MRI and MR angiography, detailed evaluation of extent and type of malformation. CT angiography, useful in evaluating bone involvement. Conventional angiography, gold standard for high-flow lesions. Treatment. Treatment depends on the type, symptoms, and complications of the malformation. Options include conservative management, observation for asymptomatic, non-progressive lesions. Sclerotherapy, injection of a sclerosing agent to shrink the malformation. Laser therapy, effective for capillary malformations like port wine stains. Surgical resection, for accessible, symptomatic, or complicated lesions. Endovascular embolization, minimally invasive technique to block abnormal blood vessels, often used in high-flow lesions. Prognosis. The prognosis varies based on the type and severity of the malformation. Some, such as port wine stains, may cause only cosmetic issues, while others, like AVMs in the brain, can be life-threatening if untreated. Multidisciplinary management often leads to the best outcomes.